Welcome everyone to our National Healthcare Not Warfare Town Hall. Thank you for joining us this evening. As we're welcoming more folks onto this call, I'll start by introducing a few of the speakers this evening. Sean Arendt is the Nuclear Weapons Abolition Program Manager at Washington Physicians for Social Responsibility. Sean is a lifelong activist and organizer, and he graduated from the University of Washington, Tacoma with a bachelor's degree in politics and philosophy with a minor in human rights. Carrie Wallace was born and raised in Southwest Washington, ancestral lands of the Cowlitz tribe. Carrie received her nursing degree from Lower Columbia College. Carrie is a wife of a teacher, a mother of three, and an active in her community. She believes healthcare is a human right and that an improved, expanded Medicare for all national single payer system is not only the most cost-effective way to provide comprehensive care to everyone, it is also the only way we're ever going to achieve true health equity. Logan Brow is a family medicine physician located in Tacoma, Washington. Originally from Plymouth, Minnesota, Logan's passion for advocacy was sparked while completing his undergraduate degree and subsequent medical degree at Kansas City University and master's in bioethics. Dr. Tova Fuller is an assistant clinical professor in the Department of Psychiatry and Behavioral Sciences at University of California, San Francisco, serving as an inpatient psychiatrist. Tova serves on Physicians for Social Responsibility's board of directors and has been involved in both the Los Angeles and Washington chapters. Julie Chung is a third-year student at Harvard Medical School. She's on the PSR Demand Access Steering Committee and was previously a Feminist Korea Peace Fellow with Women Cross DMZ. Thank you everyone for joining us, and Sean, Logan, Tova, Carrie, and Julie for presenting this evening. Please note that this meeting will be recorded. However, following the presentation, we will turn off the recording and welcome your stories and further discussion. Please feel free to put any comments and questions in either the Q&A or the chat function throughout the presentation, and we will make an effort to address them during the discussion section. Now I will pass it off to our speakers. First up is Sean.
Hi, everyone. As Magritte mentioned, my name is Sean Arendt. I am the Nuclear Weapons Abolition Program Manager here at the Washington chapter of Physicians for Social Responsibility. This conversation is brought to you by National PSR, my chapter, Washington State, the PSR Demand Access Committee, Whole Washington, Physicians for a National Health Plan, as well as their Western Washington chapter, the Labor Campaign for Single Payer, One Payer States, and the San Francisco Bay chapter of PSR. We thank you all. Thanks to all of our sponsors, we were able to help reach you all with this conversation. Next slide, please. So this webinar is kind of the final installment, an extension of a town hall series we completed in Washington State. We were trying to connect the dots between a major issue, which is healthcare coverage, and really our broken and dysfunctional medical system, as well as our country's deeply misplaced priorities in funding a new nuclear arms race to the tune of $2 trillion, to an annual military budget that's approaching $1 trillion a year. So this town hall series gave us the opportunity to speak to folks in the cities of Olympia, Tacoma, Seattle, Everett, Bellingham, and Spokane. We were able to hear directly from the audience members about their stories in terms of healthcare, what they've experienced from a lack of care, and we were able to pass the hat and raise around $2,000, partnering with a group called Undo Medical Debt to cancel about $200,000 in aged medical debt for Washington residents, and we are deeply grateful for that opportunity. This message is really important, again, just because it's what we're trying to get across is that we need a just peace. We need a peace where we're not just funding a nuclear arms race, but where we can compensate the victims of the arms race. Right now in PSR, we're fighting for the Radiation Exposure Compensation Act, which would provide health benefits to people affected by our government, poisoned by our government. But all that money is eaten up in medical costs. So that doesn't feel like justice to me. And when I see people suffering under medical debt, it doesn't feel like justice. Um, and I guess just to leave it off, we're just deeply grateful for all of you for coming here. And we hope that by the end of this, you'll be willing to take some action yourselves. We'll be providing ways to do that. And we need to rebuild both the movements for expanding access to healthcare and for abolishing nuclear weapons. And we hope you'll join us in doing that. Thank you.
All right. Hi, everyone. I am Logan Brown. I'm a family medicine physician in Tacoma, Washington. I'm going to start out by presenting our agenda today. So why healthcare, not warfare? We already did our intro. We talked about the Washington town halls that we did that Sean just presented. I'm going to focus on healthcare and military spending. I'm going to pass it on. We'll talk about the cost of war, policy solutions, nuclear expense, taking action, and then at the end, as Margaret stated, we'll work on sharing our stories. All right, next slide, Marguerite. So as you noted in the sponsor section, there's a lot of different groups coming together for this presentation. In order to do that, we kind of focus on like what our shared values are. We all agree that we should get what we were paying for. We all believe that human beings have a right to health care. And then just a note, make sure that we're respectful for the last 30 minutes of our presentation for sharing. Next slide. So what is healthcare, not warfare? So our group is a health professional-led conversation on the state of the U.S. healthcare system and national spending priorities. Right. Now we can go on to the next slide. So why are we doing this? Healthcare professionals, as many of us have experienced, have a respected voice in our society, have long used this voice to oppose wars of aggression. Our goal is to use this trusted voice to oppose excessive military spending while redirecting these resources to the healthcare of our patients and the citizens of the US. We want to use our stories and our power as healthcare professionals to advocate for these populations and our patients. All right, next slide. I like this slide. It kind of demonstrates trust within various professions. So again, kind of points to why we're using our voices. So you can see here that as far as trust goes, nurses and medical physicians tend to be the most trusted positions or jobs in our society. So it's important for us to use our voice. So that's why we're here today. Next slide. All right. This slide and graph I thought was really interesting. So what it is looking at is data reflecting the overall feelings of healthcare costs. What I think really stands out here is the significant cost felt by racial minorities. See our Black, non-Hispanic, and Hispanic population finds that healthcare to be very to somewhat difficult in cost. As well as those making less than 90K a year find our healthcare system a significant burden. Okay, next slide. In comparison, so as many of us know, the US is the richest country in the world, and that reflects our military spending. So you can see in this graph that in 2021, we spent over $800 billion on our military, which is greater than the next 9 countries combined. And then you can kind of also see the rest of the world spending 535 billion collectively. Some new numbers as of 2023 are military budget has bloated to over 900 billion. It seems like it's not going to slow down anytime soon, which is why we need to work to redirect those priorities and hopefully help improve our healthcare system. Next slide, please. And it's not only our military spending that's intense, it's our US police system as well. So comparing our funding for our US police system versus worldwide military expenditures, we actually be the third highest expenditure in military spending if it was just the US police force alone, which is pretty eye-opening to me. I did not know that before doing this work half a year ago. Okay, next slide. Very good. Okay. All right. So the American healthcare system, we would argue that it isn't meeting the needs of our citizens and it's prioritizing the for-profit mechanisms which move resources away from the needs of its citizens, and it's redirecting these to military spending most frequently. In our health care system, there are many uninsured patients who are not able to get their needs met, which is unfortunate given how much money our country does have. I'm sure Carrie will talk about this a little bit more later, but we are the most expensive system in the world per capita. In 2022, it's estimated that per patient, it costs $12,500, which is double the cost of countries like France with universal coverage. Next slide, please. I think this graph does a good job of, or picture does a good job of kind of explaining the purposeful confusion of our healthcare system. Just trying to navigate it, even myself on the day-to-day as a physician is complicated. I'll have one patient where something will cost one thing, and another patient where the same treatment or plan will cost a different amount. And there's a lot of smoke screen when it comes to how much medical procedures and treatments are actually going to cost. For my own story, I have an ankle injury and I know I need an MRI. And just even me as a physician trying to figure out how much this MRI was going to cost me was like pulling teeth. It took me a few days to figure out. And if I have to spend a few days to figure out how much it's going to cost me to pay for an MRI, I can't imagine how it would be fathomable to expect our patients to understand what their bills are going to look like after getting treatment. Next slide. Okay. So uninsured and underinsured, 26 or 27.6 million people in the US have no health insurance as of 2022. 17.5% of those are age 19 to 25, and 46.5 million people ages 19 to 64 are underinsured. When we can compare this to countries like the UK, where there's a national health system that covers everyone, being such a wealthy country, we would argue that we should be able to use at least some of those resources to make an equitable health environment for all of our citizens. Next slide. Okay, and health coverage, premiums, copays, and deductibles. I thought this was pretty eye-opening as well. So insurance companies, they'll often raise their cost of their copays. It's been demonstrated, if you note the second bullet point here, there was a Rain Corporation experiment that found that even if you just raise your copay, so when you go to the doctor's office and say, instead of paying $10, you have to pay $12, that reduces your healthcare utilization by 10%. So it incentivizes insurance companies to raise copays, even if it's a little bit, so they can advertise like, hey, we're just barely raising these, and then that's going to reduce the expenditure that they're going to have to pay out for the health of their patients that they're covering. More evidence that Profits are going to insurance company CEOs and healthcare administrators. And then on our right, the right part of the slide here, you can see some of the CEO salaries. One that was kind of eye-opening for me was Joseph Zerbetsky's salary, who works for Molina. Molina is a really big insurer that covers a lot of patients, at least here in Washington, that are on state insurance. And at least for me personally, I find it very difficult to get many of the care needs passed or moved through Molina Insurance. And I know a lot of my coworkers are frustrated with them as well. And it's kind of disappointing to see that their CEO is making so much money on behalf of that. All right, and that is the end of my section, and I'm gonna pass it over to Tova now.
Hi, everyone. So you've seen some figures already about the enormous costs involved with our military budget. 1.6 trillion annually for American warfare, 2 trillion planned for nuclear weapons. And considering the role that nuclear weapons play in quote unquote deterrence, sitting around in massive numbers, hopefully never to be used, keep in mind that this nuclear cost calculator that is linked to on the right, write that down, found that the fiscal year 2024 total expenditure for nuclear weapons programs was $94 billion. That's an immense amount of money just for nuclear weapons alone, not just military spending, nuclear weapons, which we're never going to use, right? We say we're never going to use them. Heaven forbid we do. Keep in mind the US government runs a public health care system already for the US military. And coverage is actually a major incentive for recruitment into the military. I'm going to touch upon this a little bit more, but $3.8 billion has been sent in military aid to Israel every year. That's a country that already has universal health care. We don't get that benefit, but they do. And since Israel's founding in 1948, they've received about $158 billion. Next slide. So, this is not the only conflict that we're involved in, talking about Ukraine, Russia. We're just going to keep that on the back burner, but considering something that is hot and present in the news, why are we spending money to destroy another country's healthcare infrastructure when we have a broken healthcare infrastructure on our own? The WHO found that between October 7th and that attack, of course, was atrocious. And keeping that in mind, there's a disproportionate response until September of this year of 492 attacks on healthcare in Gaza. Next slide. Congress just passed bills allocating $92 billion for weapons to Israel, Ukraine, Taiwan, the US-Mexico border. It's a country we're friendly with. And that is enough basically to build 460, $200 million hospitals. Next slide. So I want to tell you a story. I'm at work right now, actually a small correction to my bio. I'm a transplant psychiatrist. So I work with medically ill patients, and I'm part of a network of doctors on Facebook. And, I was complaining myself about prior authorization, which if you're not a healthcare professional, you don't know what that is. I'll tell you what it is. It's when the insurance company makes you fight tooth and nail to get something covered, like a hospital stay, a medication. And you have to call them and play phone tag and beg and plead and prove medical necessity. And in many cases, just obvious that it is necessary. But the hoops are set in place to make it so that they don't have to pay if they don't have to. So somebody got a prior auth for somebody's ventilator. So I'm showing you like somebody has a tube in their neck, ventilating them at all times. It is life-sustaining treatment. And a doctor was forced to call and explain this is medically necessary. I mean, it's just like the mind boggles at the insanity of our healthcare system. Next slide. So everybody has a story. We heard about Dr. Brow's MRI. I will tell you, I needed to get a mammogram. There was a finding. And as soon as I told them there was a finding, the cost of the mammogram, and yes, I understand the difference between how a radiologist looks at it, but the difference in cost was hundreds of dollars. And it's just, I feel like I'm being gouged as a patient. And then I see it happen to my patients and I get even more irate. The amount of medical debt, surprise bills. Like when I'm treating a patient in the hospital, the last thing I want to figure out is the fact that their medical bill is not being paid for by their insurance. They're in the hospital. This should not be a problem. And yet I've had this conversation. There's patients that have lack of access. I'll tell you about that on the next slide, my own personal experience with that. Anybody who works in emergency medicine or family medicine can tell you that patients who don't have insurance wait until the last minute and show up to the emergency room with end stage versions of their disease because they can't afford to go to the doctor. And then the costs are really high. People getting refused emergency services, getting refused hospitalizations, or, when I worked in inpatient psychiatry, there were patients who were suicidal and the insurance company did not want to pay to prolong their treatment or would haggle with you over how many more days you need, as if this is something that could be actually predicted. The GoFundMe, oh my God. I have a close friend who had breast cancer, who was on Facebook begging for money the entire time she's trying to undergo an incredibly stressful treatment with chemo and radiation for her breast cancer. She's trying to figure out the funds in order to pay for her life-saving treatment. I told you about prior authorization, on and on and on, waiting for specialty appointments. It's utterly frustrating to the point of desperation as a healthcare provider to see this happen and to know what our patients are going through. Next slide. So I'm going to tell you some of my stories. So the first one on the top left was a kidney transplant patient, not yet transplanted, waiting for kidney transplant. I did their evaluation last week. And, the patient was in tears talking about how she was living on the poverty line, how she can't even afford vegetables. And, when I'm doing this informed consent procedure about like, what are the risks of transplant? Why do you want a transplant? She says, actually, I'm not sure I can get one because I don't know if my insurance will cover the drugs afterwards. This should not be a concern. This is, kidney transplant prevents you from being on dialysis in some cases, is life-saving, just unbelievable. But I think an even more egregious one is on the top right. So I have one patient that is currently in the ICU across the street, up 4 floors. And he is waiting for what's called an LVAD, which is an external heart pump. And without it, he will die. He's in cardiogenic shock. He is on, for the layman's terms, basically life support right now with the medications he's on. And if you turn those medications off, he cannot leave the hospital. He will pass away and perish on his way out of the ICU. So, we waited days to see if his insurance would cover an LVAD for him, as if there was any other option for him. It's just, I mean, like you can see I'm getting irate even just talking about it. On the bottom left, a mentally ill liver and kidney transplant patient I was just emailing just now. I mean, this is every day. This is my job. She cannot see a psychiatrist for over a month through Kaiser, even though she's chronically suicidal. I said, are you going to be safe if you go home? Yesterday she said no, and we're trying to figure out how to discharge her. But part of the wraparound services you need for someone like this is a therapist, which Kaiser cannot get her. And soon follow up with a psychiatrist is just basic mental health care. And I think in mental health care, you especially see the holes in the system. So, and basically every single day, it's impossible to set patients up with outpatient mental health because the insurance dictates who will cover. I hate having to ask patients, oh, you need a therapist. What kind of insurance do you have? I'm so sick of those words. What kind of insurance do you have? Oh, you're on Medicare, Medi-Cal. Well, we may not be able to get you a certain kind of therapist. That's unfair. That's unjust for our patients. And so, next slide. You know, the last thing I'd like to talk to you about is medical billing and debt. Insurance companies are paid upfront via flat fees. The soaring stock prices are driven by higher profits, especially during COVID-19. 10% of US adults have medical debt. That's about $88 billion in collection. And I want you to reflect back to the billions and billions of dollars we spend on nuclear weapons alone. I'm not just talking about our entire arsenal, just nuclear weapons alone, and how this could be completely erased. There were 250,000 GoFundMe campaigns annually to raise money for healthcare needs, which is approximately $650 million yearly. This is a fraction of our nuclear budget. And 500,000 will file for bankruptcy due to their healthcare costs. This is something you wouldn't see in many, many other parts of the world. And it's a great injustice to be in the United States and have so many people struggling due to their financial debt. And with that, I will pass the mic.
Thank you. My name is Carrie Wallace. I'm a nurse by background. I'm the board chair of Whole Washington, an organization here in Washington working to put state-based single payer on the ballot. Here to talk about policy solutions. In the Washington versions of these town halls, we talked specifically about the Washington Health Trust. For this, we've updated the slides to look at a more national piece of this conversation. Next slide, please. So improved and expanded Medicare for all is the gold standard for folks that are working in the healthcare justice space. Having a national program is what everybody's fighting for. There's lots of different ways we do this work. We'll talk about some of the ways you can get involved nationally. We'll talk about some of the ways you can get involved at your state level because all politics is local and insurance is not healthcare. The single payer national system will benefit everybody. It'll get rid of those insurance networks that limit your access to certain providers. And it actually creates freedom of choice and creates competition. And so there are ways to talk about this topic in all kinds of audiences with in all kinds of spaces, whether they're conservative spaces or progressive spaces. One of my favorite pieces about organizing around healthcare is it's an absolutely everybody issue. Next slide, please. Nobody loves their insurance. So Logan's section of the slides covered the mess that our healthcare system is right now. Lots of folks that I work with refuse to call it a system. It really isn't one. It's really the last sense of the gold rush. It's created to be confusing and for folks to siphon dollars out of every aspect of the care. So single payer simplifies this. People and businesses contribute to a trust of some kind at the government level, and then those funds are paid directly to providers. So the biggest piece I like the most is that we're kicking out the middleman. So starting by kicking the insurance companies out first, and then going from there to fix all the other issues with the system we don't have today. Next slide, please. We've used this slide around Washington State. A League of Women Voters is also a nonpartisan organization similar to Whole Washington, but they're a national organization, and this comes from their national website. So we talk a lot about what single payer is and the benefits of a single payer system. It's also important to inoculate folks around what single payer isn't. So it's not a public option. It's not government run. It's not socialized medicine. We're just paying the bills. We had some folks in Washington with questions around, am I going to be forced to take vaccines? And the answer is no. Whatever you and your doctor decide are on your care plan, that's what a single payer system pays for. And that's really, truly freedom. Next slide, please. We've doing a lot of work together, working in coalition. One of the biggest pieces, the benefit of the town hall series we did in Washington was bringing all these different organizations together to talk to communities that might not have these conversations regularly. We have shared values we talked about earlier. We have a shared goal, which is universal healthcare at the national level. And then, you know, all politics is local. So it's our work is to educate, agitate, and organize to get folks pissed off about what's happening in the system, connected to their own personal stories in a way that motivates them to do something about it. And again, we're going to have some actions for you at the end of this presentation. I do believe we need to take an everybody in, nobody out approach to organizing. We need to get rid of litmus tests on the left. We need to recognize that everybody needs healthcare and everybody has a role to play in taking on the big money interests that are really pushing against us changing the systems as it sits right now. So really encouraging folks to not worry about whether you're focused on a state-based approach or a national approach. We're all working together towards the same outcome. Next slide, please. Improved Medicare for All is popular policy. The Healing Us documentary talks about it's like 76% of Democrats and something like 70% of independents and 46% of Republicans. This is a American policy. This is another representation of folks that overall support and or oppose this type of policy change. It is a popular policy. We just need to learn how to speak to the issue in all kinds of audiences. So hopefully we'll give you some talking points today. Also encourage folks to watch that Healing Us documentary. Dr. Jarvis in Utah, who's doing this organizing, is a Republican public health doctor, comes at this issue from a very different lens than we do here in Washington, very effective at talking to folks from all different kinds of backgrounds. Next slide, please. This slide I stole from Rose Roach, who is the president of the Labor Campaign for Single Payer, another national organization working in this space. They are not really taking an opinion on the state-based organizing, but focusing on the national level, and we need both. This criteria they developed for healthcare reform proposals is applicable, I think, to both spaces. So they put this together to look at the reality is nobody loves incremental steps towards anything. I'm not a fan of incrementalism, but we do need to be able to critically assess healthcare reform bills. Are they getting us closer to the gold standard of a national Medicare for All expanded improved type program? Or are they getting us further embedded into the pockets of the insurance companies and the lobbyists, big pharma, et cetera? And so this criteria is something that they developed, the Labor Campaign for Single Payer developed to help folks do that assessment of healthcare reform proposals that are coming in your area. So what is your state looking at? What are we looking at the national level? Is this helping us get closer to what we want? Or again, further into the pockets of the insurance companies? Next slide, please. Speaking of national policy, there are active bills right now. There is a Medicare for All, expanded, improved Medicare for All bills in both the House and the Senate. These are live active links. If the slides get sent out, Magritte, I'm not sure if we're doing that, but they are live active links, but you've got the bill numbers there. There's also opportunity to support the state-based Universal Health Care Act. This develops waivers that don't exist for states to have an easier time of getting a state-based approach approved at the state level. It's not necessarily, but it does make it a whole lot easier. So this is something Whole Washington has backed, as well as PNHP and other organizations, one payer states we'll talk about. So I encourage you to look at the State-Based Universal Health Care Act. Short term we call SABUCA. So if you've heard the term SABUCA, that's what that's talking about. And then I think we also need to talk about the Leveling the Playing Field Act, which is a defensive bill, in my opinion, around trying to make Medicare a product that can compete with Medicare Advantage plans. So Medicare Advantage is private insurance trying to take over the Medicare trust, and they are successful at that because there are gaps in what Medicare covers. Doesn't cover your eyes or your ears or your teeth, which is things that seniors need, dentures and eyeglasses and hearing aids. So the Medicare Advantage plans, those private insurance folks have a really easy time convincing folks to use their product. So the Level the Playing Field Act expands Medicare, at least in its current capacity, to cover more services for seniors. Super important. So ways to take action: call your representatives, acknowledging that a lot of the reason we don't have this stuff already is because of our financial priorities. We are being governed by folks who are lobbied very heavily for big moneyed interest, whether that's military spending or insurance or pharmaceutical industries. So National Nurses United does have a patients over profits pledge, asking candidates, elected officials, not to take more than $250 in money from the medical industrial complex, something that I work volunteer hours on to get folks to sign that. So just a little plug for there. And then support organizations that are supporting Medicare for all. Next slide, please. Single payer healthcare is pro-labor. I do a lot of work with National Nurses United because they are focused on Medicare for all at the national level. They are also embedded into certain states like California, working on CalCare. Unions spend a ton of time and influence on negotiating healthcare at the table. One of the things Rose Roach said in a presentation here in Washington was that, you know, unions and management have a common enemy, and that's the insurance companies. So if the insurance company comes and says, we're doing a 17% increase, there's, you know, are we going to fight over who's going to pay for that? Or are we going to address that issue at the cause? So again, my favorite piece about single payer healthcare is kicking those insurance companies out and really putting the funding into true healthcare. Really hoping unions will take a real strong lead in this movement. There are resolutions being passed here in Washington state in support of single payer healthcare, and a lot of that's based on templates that are available from the Labor Campaign for Single Payer. So check them out. Next slide, please. Lots of opportunity listed here. The national organizations, again, some of them take focus solely on the national approach. Some of them focus on a little bit of both. All of them are very important. All of them are doing the same work. Look for what's available in your area. If you have a PNHP chapter in your area, for example, get involved. If you know you're in California, National Nurses United and CalCare doing tons of work. DSA has lots of folks in the Medicare for all space. The national single payer, they're typically focused more on that national program. We are all doing the same work, and it's very important that this movement continues to grow. Next slide, please. All right, and so all politics as local, I keep saying that, one payer states is trying to do the work of being an umbrella for all the statewide efforts. You can see the little Washington, there's a healthcare is a human right Washington, that's their logo. Whole Washington is part of that coalition. There are coalitions that exist across other states. I just have some examples represented here. If you go to the One Payer States website, they do have a map and a list of organizations that are active in all of these states. Some of them, again, focused on state-based efforts, some of them focused on national efforts, all of them doing the same work, very important work. If you know of an organization that's not already affiliated with One Payer States, I suggest you connect the dots. The more we can break down silos and work together on this issue, the farther we're going to go. So coalition is really important. I hope that's the biggest piece you take away from my my speak. And this is my last slide. So thanks so much for your attention tonight. Do the work. Julie's going to give you some more information. Thanks.
Hi, everyone, and thank you, Carrie, for giving us such a beautiful example of the world we could live in with a national universal healthcare program. And I love what you were saying about how we really need to take that everybody in, nobody out approach to organizing. So I'm just here to wrap everything up and talk about how we can and must take action to shape policy that reflects the needs of our communities. And we'll end this part of our presentation with 2 action items that everyone can take right now on the call and hopefully send to everyone that you know to support healthcare, not warfare. So to really sum up what our speakers have said, a Medicare for all policy is within our country's means, but 920.8 billion of our taxpayer dollars fund our military per year. And it's wild to think how with that money, we can support the healthcare of millions of adults and children. And otherwise, our taxpayer dollars are continuing to fund destruction in places all over the world, like Gaza, not to mention the health of our communities, and really line the pockets of military contractors who've taken in a third to a half of the defense budget over the past decade. So the next slide. And it's not like we don't have needs in this country. I think our previous speakers have really beautifully highlighted the stories from our patients and loved ones, our personal stories that highlight just how much we are all affected by the lack of healthcare access in this country. So this slide is just highlighting that in 2022, 43% of working age Americans had no health insurance or were inadequately insured. And next slide, please. I know that for me, it sometimes feels like a very impossible or monumental task to make demands against the US military, which, as again, previous speakers have highlighted, this is the most well-funded military in the world. But as part of our Healthcare Not Warfare campaign, we're presenting our Cancel Sentinel, Cancel Medical Debt action, as well as our support for Sabuka as a way of tackling this issue together as a community. And I hope we can all feel energized, if not optimistic, about making a change and moving forward with this. So on to the next slide, please. So what is the Sentinel program? This program was introduced to replace the Minuteman as the US's new land-based intercontinental ballistic missile as a part of the greater nuclear weaponry triad of the country. So under the Sentinel program, 659 Sentinel missiles are going to be produced with 450 missile silos and 600 facilities that'll be refurbished. And most of this work is being done in Montana, North Dakota, and Wyoming. Many experts have actually come out in criticism of the land-based missile program for a number of reasons. Partially, actually, geopolitically, there's a problem with this use them or lose them pressure to mobilize what they sort of call these like sitting ducks of nuclear disaster. These missiles are in well-known fixed locations and they're sitting at hair trigger warning. They really pose an existential threat to all of us, but directly impacting those that live in the surrounding communities. And not to mention, this will cost us approximately $264 billion over the next 50 years to fund this program. So you'll see on the next slide, we really want to make clear that this is an absolutely offensive waste of resources. With the country's total medical debt amounting to something like $220 billion, this program alone would cancel all of medical debt, and we'd still have $45 billion left over to provide health coverage for uninsured Americans and invest further in our public health infrastructure. So we obviously need to fix our national priorities and ask ourselves very deeply what it means to feel safe and secure and healthy and supported in our country today. So the next two slides, I want to go over two actions that we're presenting to you all right now that you could do at this very moment if you would like. So there's the link that's presented on the slide, but I just put it in the chat as well. Or I think that there's a way to put this into the chat. But if you go to this link here, you'll see a number of actions. We want to especially highlight the first one, which is to call on your representatives to cancel the Sentinel and cancel medical debt. It'll only take 2 minutes to fill in the email form to send to your representatives. And this is, something great to do right now and also send along to everyone that you know. And then similarly, if we go to the next slide, and you can scan the QR code, but we have another link where we can send an action to your senators to support Sabuka, as Carrie discussed. This has been introduced to the US Senate by Senator Ed Markey of Massachusetts, and it allows for states to form systems that'll cover all employers and employees with much more affordable, higher quality healthcare. And this similarly should only take a couple minutes to send a message. It'd be great to flood the inboxes of our representatives.
Thank you so much, everyone, for sharing and presenting this evening. Definitely, there's a lot of content in there. So we want to move on to the next section of this evening's town hall, welcoming the stories of those who have been impacted by the injustice of our systems and spending. So to start our discussion, I'd like to give the floor first to Alex Scheel, who has prepared a testimonial for us this evening. And I'll let him join us.
Hey, am I on? Great. My name is Alex Scheel. I'm a disabled combat veteran. I organized with Tacoma Democratic Socialists of America. Sean asked me to speak tonight and share a little bit about my story. I went to Iraq in 2009 and Afghanistan in 2012. I got out of the Army in 2014. And this year was the first year I saw a doctor in over 10 years. I've been fighting with the VA to get a rating, and I finally got a disability rating last year. And yeah, and I didn't even see a doctor. It was a telehealth visit. It's really, really incredibly hard. I think we've all been at the doctor and tried to explain like what's going on with us, what do we need. And it's not only hard, but it's embarrassing, and it's really disorientating to go in and say, hey, this is what the Army did to me. Burn pits, breathing in burning batteries and oil and plastic, just physically destroying my body, carrying weight around, and most importantly, the mental health aspects that you get going to war. And I'm just now getting help after 10 years. And statistically, I'm probably going to drink myself to death, or my lungs are going to give out. And I have other friends who that's happened to, that aren't here with us anymore. Vietnam had Agent Orange. The first Gulf War, there was depleted uranium, which gave people Gulf War syndrome. This last 20 years of war, we've had burn pits and all sorts of other things. The next war is going to be even worse. We just look at what's happening in Gaza right now. It's horrifying. So the point is not to say poor me, but to me, it's organizing this, fighting for a universal healthcare system, a single payer system, not only will help me and get out of this broken veteran system, it'll help all of us. It'll be cheaper, and most importantly, taking money away from these nuclear programs, taking money away from this war machine that creates these problems, that creates these Superfund sites, that creates these horrific destroyed countries. Will prevent more of this pain and misery and suffering that I've experienced, and that we all see and experience. We all see it every day, whether it's online or in our communities. One last thing I want to say is my sister passed away 5 years ago from an overdose. She had chronic pain, and her healthcare provider decided that her care was not worth it. It wasn't worth the money. It wasn't worth their profits, and she couldn't manage her pain, and someone gave her some drugs, and she fucking died. She's not here with us. And in a just world, the Sackler family and these CEOs who are making those outrageous sums of money that we just saw would suffer the consequences. But right now, that's not going to happen. So in order to honor her and to honor my friends who aren't with us, I'm fighting for single payer. And I'm very happy to see all of you here. Incredibly intelligent people who know what's going on, fighting. So thank you. Thanks for letting me speak. Yeah, we have a whole world to win. Thank you.
Thank you so much, Alex, for sharing and being here with us tonight. Next, we will be sharing a testimonial from Teresa Horn, a downwinder from New Mexico currently battling thyroid cancer, who unfortunately was unable to make it tonight due to complications with her radiation treatment. She sent us a written testimonial, which will be read by Martin Fleck, the director of PSR's National Nuclear Weapons Abolition Program. So I'll pass it over to Martin.
Always got to remember to unmute. Thanks, Marguerite. Yeah, this is sobering. This is from Teresa Horn, and Marguerite asked me to read this testimonial to you. So in the words of Teresa, a representative for Washington Physicians for Social Responsibility asked me to say a few words about my experience of being diagnosed with cancer, but unfortunately I spent the night in the hospital due to complications from the radiation I received in June. I was raised in Tularosa, New Mexico, a tiny village in southern New Mexico, about 50 miles away from the place where the Trinity bomb was detonated. I grew up surrounded by cancer. I thought it was normal, and I didn't realize that it wasn't until I moved away from home and started to realize how far from ordinary it was. All four of my grandparents were living in Carrizozo, New Mexico, about 30 miles from the bomb site, when it was detonated. All of them were diagnosed with cancer. My 18-year-old nephew was diagnosed with thyroid cancer in August 2023. My cousin was diagnosed with thyroid cancer in October 2023. In November of 2023, my 42-year-old cousin died of bone cancer. My entire family went to Orlando for Christmas and New Year's this past holiday season. On the 2nd of January, while standing in line for Haunted Mansion at Magic Kingdom, my daughter looked at me and asked, "What's that on your neck?" I didn't know what she was talking about, so I went to the restroom to see, and I saw a huge lump on the right side of my neck. I immediately sent a message to my doctor, and she advised me to go into the ER as soon as I got home. We flew home on the 6th of January. I went to the ER on the 7th. I had a CT scan and ultrasounds and was immediately referred to ENT. Every medical professional who looked at me knew exactly what they were looking at, but didn't want to be the one to break the news. On the 12th of January, I had a biopsy and was told that they were 90% sure I had cancer. On the 16th of January, I had a follow-up and was told that it was cancer. I was scheduled for a total thyroidectomy on the 15th of February. During my surgery, the surgeon noticed that I had a suspicious lymph nodes, which were removed along with my thyroid. On the 21st of Feb, I had my follow-up and was told that the cancer had metastasized into my lymph nodes. This meant that I would need radiation. The day after I had radiation, my face swelled up and my saliva glands almost completely stopped producing saliva. And to this day, I choke often, I can't leave the house without water, and I have to have sour candy or gum in my mouth at all times. I'm not able to eat anything spicier than a pepper. I also have severe brain fog. I forget where I parked my car. I forget words when I'm speaking. I have lists and alarms for everything because if I don't, my memory will fail. Another side effect of having a total thyroidectomy, there it is not being able to regulate my body temperature. If I get overheated, I immediately go into fight or flight mode because I feel like I'm on fire. This is just my experience. I can't speak for the countless others who have suffered as a result of the irresponsible use of the land when testing nuclear weapons. Additionally, the failure of any government to provide appropriate decontamination efforts over the past 79 years. For example, there is apparently an acceptable amount of uranium in drinking water. But in 2024, there is 3 times the acceptable amount of uranium in drinking water in my hometown. This is one of many contaminants that is known to cause cancer that is systematically delivered to residents. I don't know if there are any solutions for those that have already paid the ultimate price for our government's initial recklessness when testing their weapons of mass destruction. But I hope we can figure it out before children and grandchildren start to suffer the same predictable fates. That's Teresa Horn. Thank you, Teresa.
Thank you so much, Martin, for reading that this evening. And thank you to Alex and Teresa for sharing their stories. I will now stop the recording to open the floor for those who wish to share either their stories, ask questions, or discuss some of the topics we've covered this evening.